Well, as more and more healthcare frontline workers are getting vaccinated, we're checking in with some of them about their experience. So joining us today is Dr. Larry Burchett, an ER medical doctor. And Dr. Larry, I saw your picture on Instagram. You got the vaccine this morning. Walk us through your experience. What was it like?
Well, Christina, I was coming off of a night shift, actually, and they were able to move my appointment up. There were four other people kind of distanced in the room. They had already gotten the vaccination and were waiting the 15 minutes where they're being monitored to make sure they don't have any serious side effects. Serious side effects are very, very rare. But as millions of people get vaccination, we're going to see them, kind of one in a million things like allergic reactions. I sat down, and before I knew it, it was done. Didn't hurt. It was really less than what I usually feel with a flu shot. Maybe there's a little arm soreness on the left. It was funny because afterwards I was like, my right shoulder hurts. My right shoulder is not where I got the shot. It was on the left shoulder. It wasn't that bad. I feel fine. I don't have any other symptoms.
Yeah, we see they're giving the thumbs up.
Yeah. Well, the thumbs up is so many of us working in the middle of this pandemic on the front lines. This is real hope. This is the beginning of the end of this god-awful virus and pandemic and all of the problems that have come from it. Not only deaths and all of the illness, but the economic stuff. And I think for a lot of us that have been in this fight for, months now, to get this thing it's a big day. I was watching your segment on the planets. I feel like the planets are aligning because this is the beginning of the end. Maybe I'm a coronavirus nerd, but this is a huge, huge deal, to echo what Fauci said. And I think I speak for so many healthcare workers that are excited to get this vaccination and be a part of ending this pandemic.
Okay. I didn't mean to cut you off there. You were talking about side effects, so just some soreness in your left arm. Is that right?
All I have right now is just a little soreness, right here in my left shoulder, where at the injection site. That's it. I don't have any fatigue or body aches or headache or anything. It's not possible from this kind of vaccine, mRNA, messenger RNA, to get COVID. That's not possible. You can certainly have symptoms that are signs that your body is having an immune response, which is what we want it to do. We want the vaccine to trigger your body to respond and build antibodies. And so a lot of these, things are called side effects or symptoms. They're really a positive sign that your body is responding as we want it to and making antibodies. But to be honest, I haven't really felt much at all.
Oh, I will say there's some people out there. They're legitimately fearful of getting this vaccine. I mean, what would you say to them?
In talking with patients, I would say I understand. I mean, there's so much excitement on the one hand, but just fear. There's a little bit of fear of unknown. I would say look at all of us, all of the doctors and nurses and everybody that are moving forward and getting this. Look at the study. Take a closer look at the study for the Pfizer vaccine of the almost 19,000 people that got it and didn't have a serious adverse event. There were some side effects. That's anticipated. There is a small amount of unknown and risk. We don't have 10 years of data on what happens to people after this. Compared to the risk of complications and death and getting COVID, it's a no-brainer. So I would say I understand the concern and the worry and the fear. I'm just so excited that this thing is here, and it really marks the beginning of the end of this pandemic.
Yeah, absolutely, especially since more vaccines are on the way and the rollout continues into next year. Dr. Larry Burchett, we appreciate you joining us today on The 4. Thanks for coming on.